First of all, the most obvious thing is that the public health palliative care community of practitioners, clinicians, academics has grown enormously in that time. It really has gotten big. I mean, if you think about India, it was about 80 people or so, and Bangladesh had probably double that, and Limerick was about 250, and we're expecting, perhaps with a bit of luck, maybe even double that in Bristol. So it's gotten very big. I think the second thing is that it's become incredibly more international and more widespread. In Britain, there have been major adoptions of this approach across the face of the country, and it's still growing rapidly. There's been enormous interest by governments and government departments here. And in North America, we're seeing major developments in Canada, and that's been really heartening. So I think that's been really the major difference, the internationalising of the movement and the growth in the size of the movement since that very first conference. Yes, I mean, the Compassionate City Charter is really about trying to introduce an instrument, a tool, if you like, that allows people interested in this approach to take a far more comprehensive, systematic approach. So you get a lot of palliative care services that launch a community development strategy or have a health promotion strategy. Each one of them is kind of different and idiosyncratic. Some of them are very strong with the schools, and some of them are very strong with the social media, and some have very tight government links. But there isn't a kind of a systematic tick box way of looking at things, you know. And what we want to see in a public health approach to anything, including, you know, mental health, and disability, and drug and alcohol, and maternal health, whatever it is, what we want to see is a comprehensive involvement of all the key sectors. So we're talking local government, workplaces, schools, museums, art gallery, cultural centres, social media, high streets, recreation clubs, churches and faiths, prisons, the homeless. So really the Charter is a reminder sheet. It's not quite a tick box, but it is close. And it's really about reminding people, hey, if we want our society to move collectively together, to take responsibility for end-of-life care, here's the Charter. Have a look at the Charter. Let's start here. And it does involve adopting a community development approach in each one of those little sectors, but it means a more thorough coverage.
Can you tell us a bit about the association?
The association really is an outgrowth of the growth of the conference and the growth of the professional and social movement around community development, public health approaches to end-of-life care around the world. There are a lot of people who are doing this now. As I said, the interest is very strong in places like the UK and Australia, Canada. There are major groups in Austria, Germany and Switzerland who are doing these programs now. And there's quite a lot of academic work globally looking at this. Some of it is practice-based, some of it is evaluation-based. We've reached a point now, I think, in our historical development, if I could be so bold as to use that word, to say that we need a more regular forum to talk to each other, to swap practice wisdom, to collaborate in research, and not just evaluation, but also new models of practice, to develop new models of practice, to look at where our mistakes have been, to have a forum to reflect, a place to get professional support, because often these people who are doing these programs work in isolation. So the International Association is really a federation of fellows, of like-minded people who support and feed off each other and bring a critical mass of interest and enthusiasm as well as momentum to their work. And the association is a vehicle for that.